The facility that you're walking into right now is our Network Operations Command Center. On our left-hand side, we have our transfer call center nurses and staff. They're talking to physicians and our campuses that are live on TeleTracking about needs of patients, where do they need to go. They're also talking to our primary care physicians, our unaffiliated hospitals throughout the region trying to come in. On the right-hand side of the room is our logistics and our transport team. So they're managing over 40 ambulances. They're getting patients in between our facilities, as well as getting folks to testing, whether they need to go back home. And in a critical event, they're moving our heart attacks, our strokes, any patients that need to go directly to the OR.
Now that we're integrated into the NOC, we're all on one phone system. So one of the nice things about the status indicator lights is when somebody takes a high priority call, they flip on the red light. And when you flip on the red light, that's the cue for other folks that are part of the process to listen in on that call. So anybody can immediately send a MICU, launch a helicopter, or whatever needs to happen to get the patient moved.
Data shows that we've changed our vital statistics of how we monitor the flow of patients into the organization, how we monitor the movement of patients within the organization, how we flow and move patients out to discharge, have all improved.
We are close to capacity just about all times. So our inpatient census has doubled and our ED volume it fluctuates. We're still trying to find whatever that new norm is, but we're up at least 50 visits per day at this point in time. And there are some days that we're doubled. Without TeleTracking, we would not have had the process in place that is the right thing for our patients. They would have been waiting hours in our ED. So that's been a huge improvement to us.
Getting our patients from our procedural areas into the inpatient was a very different workflow to where we were actually holding beds from the night before, knowing that we were having an OR patient or a scheduled cath lab patient come in, to where now they're now requesting the bed when it's needed versus having it 12 to 16 hours in advance.
So this is our TeleTracking board for this unit specifically. And as you can see, it's a comprehensive view of our patient census and gives us a lot of information in a very quick view so that the team can stay on task with expediting those patients out of here, removing barriers for them, identifying our patients in OBS. It even has nursing assistant and nursing assignment, which is really awesome, and then who the attending physicians are for those patients.
One of the greatest things that we have had from TeleTracking has been our room turnover time. It was an ache and a grumble and a complaint every single day in bed meeting about how long it was taking for our beds to be turned over and clean. It was just literally a struggle every single day. And with TeleTracking being in our system now, rooms are turning over faster than nursing is used to. Our patients aren't waiting. It has been the biggest win for everybody.
We see 1,000 ED patients a day. All of that's now done in this site, where you can see no chaos, it's quiet, people are happy. They find meaning in the work that they're doing, but it's because as a health system, we decided to do something different.
We're defining processes and procedures so that the people at the front end can rely that the people in the receiving end are ready and able and willing to take care of that patient. And for us, that's delivering that's the Kettering brand, is that best practice.
I think most CIOs recognize that rarely is it just a technology implementation. And I think that one of the real strengths of TeleTracking was the assistance with the organizational development and change piece of that. It's not just go deploy the technology. It's truly how do you get the hospitals and the clinicians and everyone on board that needs to be on board to actually leverage the technology and utilize it. And to think about the level of sophistication, the organizational development and change that's required to put in place a command center, and to do all that in 12 months, I think just speaks volumes about how successful the implementation was.